Hello, my fellow dental professionals. Welcome to another episode of iDent Talks, the place where science, clinical practice, and experience comes together to elevate your professional journey. I am Dr. Richard Callas, oral and maxillofacial surgeon, and today we are diving straight in one of the most common questions I get at conference, in my dental meetings, in WhatsApp groups, and even in a coffee line. Dr. Richard, what's the best dental implant in the world? Let's start by busting a myth. There is no single best dental implant in the world. What there is a system that's most appropriate for you, your patient, and your treatment plan. But don't worry, that's not a vague answer. Let's break it down. What makes a dental implant good? First, we need to talk about titanium quality, surface treatment, macro and micro geometry, implant abutment connection, and primary stability. These are all critical to osseointegration, long-term success, and biomechanical performance. Brands like Nobel Biocare, Straumann, Neodent, AstraTech, BioHorizons, they all offer top-tier technology, and they are backed by years of clinical research and success. But let me ask you this. What good is the best implant in the world if the surgical protocol isn't followed? The case wasn't well planned, the graft didn't integrate, or the final prosthesis ignores occlusion. The best implant depends on the surgeon. Yes, you are correct. Depends on you. So, if you are just starting out, you might benefit from systems that offer strong local support, accessible guided surgery options, hands-on training, and clear protocols for beginners. Now, if you are more experienced, you can venture into systems that allow greater flexibility, like platform switching, narrow diameters, or even zygomatic implants, in extreme cases, pterygoid implants. A real clinical example. One of my students during one of our ABA training programs was loyal to only one implant system. He said, "This is the best one. I've never had a problem with it." Then came a case with a very narrow ridge. He insisted on using his usual system, even though it wasn't ideal. The result? Early failure, re-entry, grafting, replanning, and delayed prosthesis. The patient doesn't like this. They don't like. So the takeaway? The best implant is the one that fits your plan, not just one sit in your drawer. What do the study says? A study published in the Journal of Oral Implantology compared multiple leading systems and concluded they all show high successful rates long-term when properly indicated, planned, and placed. So, what's the biggest variable? Do you know? Yes, it's you, your knowledge, your planning, and your hands. A tip for those starting out: choose a system with scientific backing. Build a good relationship with your local rep. They can save your day sometimes. And most importantly, invest in education. There is no point in buying a Ferrari if you don't know how to shift gears. So now, if you ask me, "Richard, which system do you use?" I will answer honestly, I use the one that gives me predictability. Today, I use Nobel Biocare, but I've used many others over the years. And if tomorrow a better, safer, and more stable system comes along, I will switch. Because my loyalty is to my patients and not to a brand. So, what about you? What's your goal to the implant system? Let me know on Instagram or through the course, WhatsApp groups. Let's share ideas and grow together. And if you want to go deeper into system selection, bone types, loading protocols, and prosthetic design, check out the programs at Australian Biocare Academy, from foundation to advanced, with real surgeons and one-on-one mentorship program. Thanks for joining me in this episode of iDent Talks, where dentistry speaks loud, clear, and with purpose. Until next time, remember, it's not the implant that makes the surgeon. It's the surgeon who makes the implant work.